Hello students, we have heard about hygiene, personal hygiene, food hygiene, environmental hygiene. All those hygienes always lead to us health, right? So same way, have you heard about mental hygiene? How we can have a hygiene to our mental health? So that unit we will discuss now about the concept of mental hygiene, because it is a science which suggests measures for preventing the mental illness. If I want to be free from any mental illness, I should be mentally hygienic, or I should restore my mental health by cure of mental illness. So it is given by American Psychiatric Association. Another definition is there. Mental hygiene means the investigation of law of mental health. There is no as such laws, but still there are some characteristic features of mentally healthy person. We will see in the further slides. So those characteristics has to be fulfilled. Then we can say I am free from such disorder. Why we need to think about mental hygiene? Prevention of mental disorder. That is the first aim, because if I do not get into any mental disorder, I need to have a proper mental health. You know, many mentally sick patient comes to hospital because of poor mental health. Maybe depression, maybe mania, schizophrenia, or neurotic disorders, or any personality disorders. You will learn these disorders in your psychiatric nursing, but still I just want to make you aware about those disorders. If we want to prevent, that means you should be mentally healthy. Then how to preserve the mental health, and to discovering various methods, therapeutic or treatment measures to cure mental illness. Then concept of mental health. Coates and Mosley said mental health is the ability which helps us to seek adjustment. Adjustment is also one of the important topic in this chapter about personal adjustment as well as social adjustment, and how to adjust in difficult situation. If I am in a problem, whether I am able to manage my problem effectively or not. So those adjustment is very important. If we are able to adjust well, that means I am capable, I am mentally healthy. Another definition of mental health is given by K.A. Menninger. There are lots of definitions, but still you can write your own. You can search for good definitions. It is defined as the adjustment of human being to the world, how they are adjusting and to each other with a maximum of effectiveness and happiness. Whether they are happy or whether they are able to fulfill their adjustment, and it's the ability to maintain even the temper, your alert intelligence, socially considered behavior, and happy disposition. Happy disposition means happy or enjoyable characteristic features in your mind. Now this is very important topic, characteristics of mentally healthy person. I am just asking a question, are you healthy? So how you are telling yes or no? Healthy means what? According to WHO, because we all learn WHO's definition, which is considered in a standard or a universally accepted definition, right? Health is a state of complete physical, mental, social, spiritual well-being, not merely in the absence of disease or infirmity, right? So it is the state of complete physical, mental, social. So are you healthy means are you physically healthy? Physical health means I do not have any illness in my body. I can move, I can talk, I can see, I can hear. I do not have any chronic disease. So such conditions you can say I am physically healthy. Now I am physically healthy, that is why I am taking class for you. But are you mentally healthy? So how we can say I am not mentally healthy or I am mentally healthy? People may think that I am not having depression or I am not having any psychiatric disorders like a depression, schizophrenia, or I am not a psychiatric patient, then I am mentally healthy. Not in fullest way. You must know some characteristic features of this mentally healthy person. It's very important for exam point of view. They may ask you, are you mentally healthy or not? If anybody asks me, just see whether I am able to fulfill all these characteristics. Then we can say I am completely mentally also healthy. Like for example, the first point is mentally healthy person feel good about themselves. They are not overwhelmed by their own emotions. Yes, fear, anger, love, jealous, guilt or worry. They do not have any jealousy, guilty feeling they do not have, they do not worry. So do you think you have such features, or we all have? Sometimes we fear, sometimes we get anxiety, sometimes we feel guilt. So sometimes we get this, but if it is for a longer period of time, then we are not mentally healthy. They can take life disappointment on their stride. I can accept my disappointments. I can tolerate myself. I am having easygoing attitude towards any tension. Any stress is coming to me, I can accept this. If anybody is telling like that, then you are mentally healthy. So this is the first point, that you have to good feeling about themselves. खुद के लिए हम कितना अच्छा फील करना. So that is first point. You cannot underestimate or overestimate your abilities. No, I cannot do this. I am not self-confident. Yes, I can do this. Yes, I am very much confident. So not overconfident, not less confidence also. You have to accept your shortcomings. Shortcomings means your weakness. I have this weakness. I have these limitations. Self-respect is also important here. Able to deal with the various situations, and you can take pleasure in simple everyday things. If you are getting pleasure, you are thinking about happiness, joy in everyday life, then you are mentally fit. Then you can see another feature, another important, this numbering is not like that all these numbers are cut. You may refer many books, so you can get good number of characteristics, but I am telling about main characteristics. The first was mentally healthy person, like a feeling about the self, how they are feeling about self, and under that we have seen total 8 points, right? Next is about feeling about others, how feeling about others. In that also we have some characteristics of mentally healthy. Comfortable with others. They are able to give love and consider the interest of others. They know how to love others, how to take interest in others. They have personal relationships that are satisfying and lasting, good relationship. They maintain good intimate relationship with others. They like and trust others. They feel that others will like and trust them. They always feel people are liking them, people are trusting them. They respect the many differences they find in the people. They do not take any advantage of others. They will not misuse others. They will not take undue advantage of others, as well as they will not take any other person, they will not allow to take advantage from self. So these all are points related to others. First point was about self, how you are taking care of yourself. Here you will how you are comfortable with other people. You feel you are in a part of group, you feel you are in having a responsibility. So just see that these all points are matching or not. Whether I am having these characteristics, then I can say I am mentally healthy. And last point is meeting the demand of life. So meeting the demand of life is also important point, because how we are meeting our demand, because our demand towards life have lots to do, right? So here you see, thinking about the problems as they come. As problem comes, I am able to do something to my problem. I am able to solve my problems effectively. I can accept the responsibility. I can shape my environment wherever I possible. I can adjust to the environment. Already I told you about adjustment, personal adjustment and social adjustment. They can plan ahead. They do not fear about future. They welcome new experience and new ideas. They always use talents. If people are showing any experiences or any ideas, they can accept that, and even they always use their talents. I should understand my potential. Where is my limit? How much I can go? How much I can do? So if I am using all my talent and potential, that means I am mentally healthy. I am meeting the demand of my life. I have set my goals. Already I told you, you should have a immediate goal, short-term goal and a long-term goal. For example, if you want to study, so immediate goal is I just want to pass the exam because exam is coming next week. Immediate goal, just to pass exam. But what will be my short-term goal? Short-term goal may be for 1 year. This year I should pass at anyhow I should pass my first year. Then what will be a long-term goal? I should pass my 4 year very easily in an easygoing manner, and I should achieve any good job in maybe in government setup or private setup, or I want to become a businessman, I want to achieve a good human life. Such things are long term. So if you are setting such goals and you are able to do, you are mentally healthy, you are making your own decisions and you are putting your effort to get it to be done, and we will feel satisfied because you are putting maximum efforts to do. So these 24 points are mentally healthy person's characteristics. It's very important, these 3 characteristics. Always the question comes because why people have to say I am mentally healthy. Next, we'll see about warning signs. If I am not mentally healthy, what will happen? My mental health will be poor mental health. So already we have discussed in stress chapter, in emotion chapter, what will happen to our body as well as your mind. Like emotionally we'll be upset, our self-confidence we will lose because we feel that I am not able to do myself, I am dependent on others. Frustration, already I explained about frustration, conflict in motivation chapter, because 2 goals are disturbing us. Strain, when your body have more stress, it is known as strain. Over anxiety, lack of decision making, you are not able to achieve yourself and you always feel dissatisfied, and you always live in imagination or fantasy. People live in imagination, they do not know what is reality. These are general features, but our body also affect. You know, there is a relationship between body and mind, so these 2 are interconnected. So if your mind gets affected, your body will also get affected. If your body gets affected, your mind will get affected, like back pain, body change, appetite. You will may get increased appetite, you may get more food, you need more food, or you may not need food. Your chest pain, diarrhea. I told examination time also students may complain like I am having diarrhea, I am having constipation, I am having ulcer, headache, body pain, palpitation, like heart is running, like that. You feel that heart is running like anything. Insomnia, sexual issues. Insomnia means loss of sleep. You already learned this. Excessive sweating, weight gain, weight loss, shortness of breath. So many symptoms you can quote it because these all are directly or indirectly connected with your mind issues. That is why these are poor mental health signs. Behaviorally, what will happen? If I am not mentally fit, if I feel that I am not able to do whatever I want to do, I will change my mood, I will have aloofness, loneliness feel, I will be socially withdraw myself. Irritability, very common terminology, because people get irritated very easily, quickly, because they want everything according to their expectation. If the expectation doesn't meet, they feel irritated, they will feel short-tempered and anger. Anxiety, illogical reasoning, paranoid. Paranoid is a psychiatric symptom actually. You will learn in psychiatric nursing. Paranoid means we are always having suspicions about others. Paranoid delusion. They are having a false belief that somebody is going to kill them. If I am a doctor, if I am a nurse, I am talking to the patient, and if the patient is having paranoid delusion, it's a disorder, it's a symptom, they may feel that I am going to kill them. Or they may tell, the psychiatric schizophrenic patients, no, they may tell that my family members want to kill me, they are putting poison in my food. So this is very like a severe attack of any mental disorder. That such case, this paranoid or delusions will come. Delusions are false beliefs which are irrational, which doesn't have any rationality, because people may think in that way. One example of delusion is delusion of grandiosity. They may think that I am the king of this world, I am the prime minister, I am the president of this country, you should obey me, because they are in self-exaggeration world. They believe that they are this, they are that, they are God, or they are magical power, but this is just false belief. Why this is happening? Because they are affected with mental disorder. Hallucination, already we have discussed in your perception chapter. Hallucination means perception, false perception in the absence of stimulus. You have learned about hallucination like visual hallucination, auditory hallucination, related to all your sense organ. Tactile hallucination or gustatory hallucination, olfactory hallucination. Why this hallucination? Visual means you can see somebody when others cannot see. I will see God is talking to me. Auditory, I will feel insects are crawling on my skin, somebody is touching behind me. I feel gustatory, like some taste is coming in my mouth, some bad taste, some bad smell, olfactory hallucination. These are hallucination like a false perception in the absence of stimulus. Only mentally ill patient like a schizophrenia, they get hallucination. They may talk by self and they tell somebody sitting with them, and we cannot see anybody, but they feel that because it is a disorder. Alcoholism, drug abuse, chain smoking, continuous smoking, thinking about suicide, always think if they are depressed, they feel they are hopeless, helpless and worthless. So their next step is to think about suicide, loss of interest in any activities, nightmares. Nightmares means in the night time they may doing dreaming, fearful dreams at the night time. Daydreaming also happens, difficulty in concentration or memory loss also gets occur. So these are various warning signs. So till now we have seen about concept of mental hygiene, mental health, and what are the characteristics of mentally healthy person. Then we have seen if mentally healthy person is not fit or mentally healthy, then they will become mentally ill. Their characteristic features, their sign and symptoms we have seen. But then we will see, in fact, these all symptoms are there, but always there is good treatment. There is promotion of mental health. So what are those mental health strategies? How we can prevent this? Everything is in our hand in a human being. Primary prevention, there are 3 types of prevention. Normally also, you know about that. One is primary prevention, another one is secondary prevention, and third one is tertiary prevention. Okay, so we'll see one by one about the preventive aspects. Primary prevention means prevent the occurrence of the disorder before the disorder comes. That is primary. Means if I am having any disorder, then I cannot be a primary preventive aspect. I should not go for that. I will go for secondary approach. Primary means before the disorder is happening to me. Maybe some person may think, if the mental disorder people get married to each other, mental problem will solve. No, never. So what, you should not allow any mentally disordered people to marry, especially for chronic case. But some parents, what they do, they hide this information from the spouse's families, right? Some people may think my child is mentally retarded, so better he will get married, he will get cure from the disorder. No, better you do not allow marriage. If we allow marriage, then afterwards whoever child if they are getting, the child also will get mental disorder. So it will transfer from generation to generation. So better do not allow such people. This is a primary prevention. So primary prevention means the preventive aspects occurring before any disease. Then mental disorders can be prepare the people to stable personality, education of the community. You can communicate this information to the public also, going and giving awareness, because mental health people, the mental health people do not have much awareness till today also. People take it as a mythology. They may not accept the society. If anybody in my home is mentally ill, if I am putting them inside only, I am not allowing the person to coming out, it will be a great problem to that society as well as that person. Better you should allow him to come out. You should take treatment. You should give awareness. You know how many celebrities these days they are promoting about mental health. Simple example about Deepika Padukone. She had like you all know about her, a Bollywood actress. She had depression in her child. She started her NGO based on this depressive people, and she came to the public and she announced about this. I had depression, I took antidepressant medicines, and now she's working along with her film shooting. She worked for the public about the depression people or depressive activities, various campaigns also she do. Why she do? Because it's awareness, very essential things. So many people, being a mental health specialist, being a mental health nurse, we all must do such awareness to prevent any mental disorders. Even prenatal and postnatal. Prenatal education means before the delivery also, mother should be trained. If the mother is having any problem, any stress, it will go to their child, and child will also born with mental disorder. Even after delivery also, postnatal also we should train. Parent and children should be given education about disease and mental health. Secondary prevention means you have to identify and put immediate intervention. This is primary means before the disease. Secondary means during the disease, immediately after the disease what you can do, because you have tried your level best to stop the disease. But if suppose they got the disease, then we can go for this secondary disorder. Like if the person has any loss in his business, he lost the economy, he lost his finance, his business was in very loss and damage occurred, then he prone to develop mental disorder. Then it can be prevent. How we can prevent? He may in tension, depression, stress. You can give proper care of treatment, admit him at the hospital at the earliest, start treatment of anxiety and depression, and give appropriate care and follow-up care. Otherwise, what will happen? The client will go in chronic case. Now it is acute, he is suddenly getting. Otherwise, it will be chronic case. Tertiary means third level. It is a rehabilitation, because we want to give proper rehabilitation means reversing back to, because we want the person to come back to normal. So after the treatment, secondary prevention occurs, and after the treatment we go for tertiary prevention, so that relapse does not disappear. Relapse means it is not repeating, the disorder will not come. But many disorders in the mental health are like that, they may come back if we are not following the treatment regularly. So rehabilitation is according to the person's level. Follow family support, occupational support, recreational training. Even in mental hospital, you may visit some psychiatric hospital. You can see people how they are engaging in the various activities. Like you see how they are doing various activities. They are making food packing, or mental people, they are involved in all the recreational training. So this is tertiary prevention. So you are seeing 3 levels of prevention: primary, secondary, and tertiary. And better mental health can be achieved by promoting these training programs through the education institute. Every education institute these days, for the schools, even for colleges, not only nursing, I am telling, every college or schools, even teachers have been trained, and teachers are training their children also, because small children are also getting mental health issues. They are always having behavioral problems, even suicide, thinking of suicide. Even police and social service agencies, even military personnel also, they get also trained about this mental health. And the community mental health are also there are various community mental health centers available in India, and national level and the state level, or in the district level also you can visit that level, and they are also promoting mental health. So it include all the campaigning and developing of personality, stress tolerance education. They will reduce the stress and avoiding the alcohol and drugs. All those training, even for alcohol people also, rehabilitation centers are there. They are known as Alcoholic Anonymous Group. Means they are having like a rehabilitation center to de-addiction center. These centers are known as de-addiction center, where they can stop the addiction. D means stopping. So de-addiction centers are there, where alcohol, tobacco, chewing, all those people can be admitted. They are training them, and gradually they will stop such habits. Spread the awareness. That is our job being a nurse. And counseling centers are also there for psychologists. Even nurses can also start some counseling center. If we are doing some courses on counseling, we are also eligible to do, if we are completing that course in related to counseling or psychologically, like counseling trainings and family counseling, marriage counseling. This type of counseling are necessary before giving about patient's care. Now very important topic, that is another important topic, defense mechanism. Once I told about this defense mechanism in ego and superego, because in ego people gets weak, they're not on reality. I hope you remember one example of mine which I taught you in psychoanalytical theory of Sigmund Freud, eat ego, superego. Like, as I want to eat food, I am taking class in front of my students. I want to eat the food and I want to take the class. So this is my eat, pleasure principle. But my superego, my moral principles will not allow me. It will tell me from my inner science, conscience. They will tell me like, no, you cannot eat in front of students. It is not good while taking class. Then my ego is my I feel, my reality of my I gets disturbed, got hurt, and I will think, how can I eat food? How can I not want to avoid? Then what I will do? My ego is getting weak, then I will apply some defense mechanism. That is ego defense mechanism. So this is just an unconscious process that defend a person against anxiety. Because I am getting anxiety, otherwise my ego is getting weak. Then I will tell my students, principal is calling me, so I am going to principal room. So students will sit in the class, and then for 5 minutes I will go to my staff room. I will eat food. I will not tell the students that I am going to staff room. They will think I am going to principal room. I will eat food in my staff room. Then I will come back. I will feel satisfied. And this is a defense mechanism I have used here. Which defense mechanism? I have given excused. I have given some excuse to the students that I am going outside because of this. So this defense mechanism is to protect ourselves for any anxiety or threatening conditions. And we also know this defense mechanism as adjustment mechanism. We are adjusting with this. Everyone in our daily life use this defense mechanism. But always remember, defense mechanism usage is okay, but it is not used properly. It will cause mental disorder if we are not using. Excessive usage is not acceptable. Also, it can call it as ego defense mechanism, because we want to defend our ego, ourself, from that threat. So we'll see one by one. These are the various types: successful defense and unsuccessful defense. So successful have repression, rationalization, intellectualization, compensation, substitution, sublimation. You just by heart this defense mechanism, because many competitive exams they ask these questions. They will give one example and they will tell you identify the defense mechanism. Even at the end of this defense mechanism section, I will also show you some examples for like an MCQ type, not MCQ, just to identify. So you will also just refresh your knowledge. Unsuccessful defense mechanism like suppression, reaction formation, displacement, denial, isolation, projection, regression, conversion, fixation, fantasy, withdrawal, and identification. So successful defense mechanism is also known as positive, and unsuccessful is a negative defense mechanism. See, the first thing, repression. What do you mean by repression? Repression means the automatic, repression, from the repression till sublimation, these all are positive defense mechanism. I mean successful. We can use somewhere it is success. Repression means it is a positive mechanism. It is an automatic inhibition. Inhibition is stopping of our any impulses, threatening impulse. It is a process by which individuals strive to keep unacceptable or painful or anxiety, needs, urge, feeling associated with them in the unconscious layer of your mind. Okay. So something is there in your unconscious mind. You are repressed it. You do not want to remember that. Such cases are positive defense mechanism. You are defending yourself. You are defending your ego. You are protecting yourself. So defense mechanism is protecting yourself from the ego, weak ego. See the example. If a man is jealous of his friend's success, but he is unaware about that, he will not show, he is repressed, but somewhere other way it is there. Another one is person who is having painful experience, whether with a teacher. Teacher may have behaved badly with that student. Then student will always tell, I do not want to remember the teacher's name. Even after many years also, he may forget, but it is there in his subconscious mind. So see, conscious mind is very less, but subconscious or unconscious mind are there too much. It is covering in our mind. So this is repression. Clear about repression? So repression is a positive defense mechanism. We are keeping hide our unacceptable emotion. Next is rationalization. It is also a positive mechanism. It is where we are individual justify our failure, like I am justifying myself, and socially I am doing any behavior like that. Okay. So I can see it is symbol meaning blanket to cover the human weakness. I have some weakness and I am covering it. That is rationalization. Giving excuse with a different reason. Students also do something. Don't you think so? You do like that. Even you see one example, a tense father who punish his child may rationalize that he is acting for the good of the child. Rationalization. Okay. Rational, giving reasons. So he will tell that I am punishing my child. Why? Because he already tensed, but he is not accepting that I am tensed. He is just telling, no, I am punishing. Just my child should do good thing in his life. That is why I am punishing. But ultimately, what was the reason? He was tensed. That is why he is punishing. So sometimes we tell rationalization in different way. I'll give one example. There are of two types. One is sour grape mechanism and another one is sweet lemon mechanism. Have you heard about this sour grape story? Angur Katta, like story of a fox. You see this fox, there was a fox and fox want this grapes, right? And he was trying to he was trying to grab that grapes. He tried many attempts but he did not get it. And finally what he said, what the fox was telling, no, that the grapes are sour, जो अंगूर है वो कट्टा है, so because I cannot eat this, because he could not achieve that. So sometimes we do because we want to give our demerit. Another example, a boy may fail to win a place in a school team, cricket team. So he could not get a place in the school cricket team. So he maintained that he did not want to waste money by playing the cricket or waste time. Why should I waste my time or energy? But he did not got selection. So ultimately the rationalization was he did not get the selection, but he's not accepting that I am not a good player. He's saying that who want to play in this group, like that. Sweet lemon means lemon is more sweet when the lemon is not a sweet fruit, right? So why this they're dealing? They're just justifying the lower achievement by pointing out the merit. Here it was pointing out the demerit, here it is pointing out the merit. A poor man does not want to earn more money. Why? Because he just justifying that money is the root cause of many. Because he is many evils. He is telling that he is poor, he is a beggar and he know he cannot earn money. But still he is tell that why we need money, because money will cause many problem in life. So this is the thing, rationalization happens, always giving excuse. Sometimes students also give, I cannot go to that place because we know that we cannot go. But still we said, who want to go that place because that place is not good. Intellectualization also another positive defense mechanism, successful defense mechanism. Here the person will think about their intellectual power of thinking, reasoning, analyzing. Intelligent will be used, like a nurse will use, like a patient is very much severe. So nurse should not cry with that patient. Instead she should say, every patient have problem, this is a short life, so nobody in this world is permanent. So you may use our intelligence to accept the reality. Compensation, we all heard this compensation word. Even in our normal duty patterns also we may get, if I am absent in clinical duty, then my teacher may tell to me that for you have to do compensation duties. Why? Because I should compensate my missed or absent hours. Same way, it's a defense mechanism. It's something given to replace something. As a blind person, some people say if the person is blind, they cannot see, but their hearing will be very sharp. It's like a natural thing. Or a student who failed in his study, how he will compensate? He's failed in study, so he will become college champion, or he will become champion in sports, something like that. He will replace himself. You did not get admission or in nursing, or you thought that you are failing in your first year subjects, so you will do activity in some other things, so you will become compensating. But you cannot achieve the same thing, that always you remember. This is also a positive thing, substitution. In games and all you have seen, people always put substitutes. If one person gets injured, another person will play instead of him. Same way, substitute means reducing the tension, we have to employ something else to put some substitutive action which have similar characteristics. A student, generally nursing students tells always like that, they did not get admission to MBBS, so they substituted the course with the nursing or physiotherapy, just to see which are the similar course related to health, and based on that they just did. Sublimation, it is also a positive defense mechanism. So in this video you can just give a pose for each defense mechanism and give a note on each of this, so you can remember and just think how many of us are using this defense mechanism, right? We all use this in some or other way. It is also a positive defense mechanism where our impulses will be directed towards socially useful goal. Example, a young man who has lost his lover. So what he will do, he cannot do anything, so he will start writing poem on love. So he is channelizing his desire, because he did not get that girl or he lost that lover. So instead of that love is not lost. only that lover is lost. So love can be channelized in some socially acceptable. So in the poem, what will happen? Everybody in the public will read the poem. So it is socially accepted. So that is sublimation. A person who has aggressive feelings, they are not able to accept or express in the society, but they can become a boxer or soldier. I am not saying all the soldiers or all the boxers are using defense mechanism sublimation. But for example, if I want to become a fighter, but I cannot fight everybody in the public. So instead of that, what I will do some action where the public will accept. So public will accept boxing because boxing is a common sports or it is an acceptable sport. So there I can do fighting. So some or other way we are channelizing our desire in an acceptable way. Another example is personal satisfaction of the individual. Suppression is also a positive defense mechanism. We are intentionally suppressing our feelings in like some unwelcome memories or something like that happened in our mind. You are keeping for some time. That is also a good thing. Every time we should not think about that. Repression was we are repressed everything inside the mind and it is not there, you are forgotten. Only some situation will come, you can remember. But suppression means you are just suppressing the desire, but for the time being. But again, you can bring it back. You can kept out of awareness. For example, simple example, a student taking examination, he is getting upset because some incidents occurred before that. He was arguing with his friend. So what happened? Suddenly he want to attempt the exam also. Now examination bell has rang and he want to go to exam and he already had fight with a friend. So what will happen? He will put his all feeling, emotion, thoughts in out of her mind. She or he, whoever, she put in her mind and as soon as she can finish her examination. So you will think I will not remember now, I'll just complete my examination. After examination, she may go and deal with that case. Otherwise, she is just suppressed for the time being. So it is also intentionally, we are pushing all those awareness intentionally, purposefully. Reaction formation. So see, these all are various, in the slides you can see, I'll just make you aware about substitution, sublimation, suppression and reaction formation. Suppression is not positive defense mechanism, it is a negative defense, mechanism. And reaction formation is also negative defense mechanism. Why? Because it is not a good thing. We are concealing a motive. Conceal means hiding. We are hiding some motive from ourselves, from the strong expression to the opposite expression. For example, I love this person. So, but I love this person from my mind. I love this person too much. But in expression, in externally, I will show that I do not love you like that. So that is, you are hiding that motive. You are keeping everything in that reality inside you and showing just opposite. Some people, like a woman, she dislike her mother-in-law. She don't like her mother-in-law, but she hide all the feelings and she will say, always be nice to the mother-in-law. So mother-in-law also feels she is very good with me, but inside her, she does not like. Nurse also requests the doctor for the special care for the patient whom she does not like. She does not like that patient, but what she will do, she will tell the doctor to take proper treatment, give proper treatment. Inside, internally, she did not like. This is reaction formation, concealing something and showing different. Displacement, negative, unsuccessful defense mechanism, because we are displacing, we are shifting our thoughts. Displacing means shifting of thoughts from one person to another person which is less dangerous or neutral. So I may, if I am a teacher, if a principal has shouted on me, I cannot shout back to principal. Instead of that, I will displace my feelings to my students in any reason, and I know students will not shout back. So we will always try to find some neutral object where I can displace, I can shift my thoughts. So it is not negative, it is a negative, it is unsuccessful. See the mother scolding a school-going children for not doing well in class test. And the child get angry. Very quickly she get angry, but not shout backing at the mother. Why? She starts fighting with his brother. Because she is having fight with the mother, but she cannot go back and shout to the mother. Instead, she will go to the younger brother and will shout. And younger brother is a neutral part. Woman harassed by her boss at work initiate an argument with her husband. She cannot, that woman cannot shout back to the boss. Instead, she will go to her husband. Then the little boy also, same example, bitten by some schoolmates. So what he may go and do younger brother kicking or slapping his younger brother, because he feel that the schoolmate is little strong, I cannot do back, better I will do in the sense he will put some angry on others without any reason. Denial is also negative. Denial means not accepting. I am rejecting myself. I am not accepting. If I am having any disorder, for example, the patient is having myocardial infarction, it is a part of heart disease, like a heart attack. So he will not accept, no, I do not have heart problem, because unconsciously he know that myocardial infarction will disturb him, it will bring lot of restriction. He know that heart problem, if I am having heart problem, it will disturb my routine life, my lifestyle, so better I will not accept that. No, I do not have. Person's death in the family, it is the greatest, बहुत अच्छा ज़्यादा होता है लोगों में, because denial is always seen as a first stage of even in the grief. Any loss also occurs. If somebody got dead in my family, suddenly it is very difficult for me to accept that. I will deny that. Later I may accept. So this is also defense mechanism. Isolation is another negative defense mechanism. We may cut off or blunt off what is unacceptable in the whole situation. Instead of being in the possession of all the fact of situation, he may not recognize them for what? Because I want to isolate myself. Some people, the mother of a severely retarded, mentally retarded, I already told about MR, where the IQ will be less than 70. So such child, what will happen? She regards her child behavior as a little different from other child. She will isolate, or sometimes I will also feel that I am not good enough. I will isolate myself from the society. I will not go to the society. Projection, we are projecting sometimes. Students also use shifting one to another, blaming others. Why you have not studied today? If student is being asked by teacher, they will tell many excuses. They will blame, like, no, light was not there, electricity was not there, or I could not understand, my mobile was not working, or my relatives were there in my home, any excuse, or I am having health issues, something like that. The boy falling from chair may kick the chair for being responsible to the fall. If I fall from my chair, I will kick the chair, because because of chair I have been fell down. Student caught while copying in the examination, generally happens. No, student, they are doing cheating in the examination. If teacher has been caught them, if they are asking them why you are cheating, then they'll say, why I can't do? Because all the students are copying, everybody is cheating, that is why I am also cheating. So this is projection. Regression. Regression mechanism is going from present to past. Very important, present to past level of behavior. Symbol meaning is less maturity. You are not mature. I am an adulthood, but still I am mature like a child. I am not mature. I behave like a child. Temper tantrum, tears, childhood behavior, right? Overcoming stressful situations. I am a 30-year-old child and I start crying if somebody shouting on me. It's not a good habit. It is a childish habit. This is regression, because I am going back to my childhood memories. Older boy may regress when his new brother is born. He feel neglect or deprived. He feel that somebody is born in my family, so I am now being neglected. So he may feel that I should not be good to that brother. Conversion. Conversion is also negative. Conversion means our emotional conflict, strong emotional conflict, will convert into physical symptoms. Why you have not studied? I am having stomach ache, and if I am checking your stomach, if I am checking your blood, everything is normal. Then where the problem is? Emotionally. So whatever is there in your mind, your emotional stress, that will convert into physical symptom. That is conversion. We are showing physically, because we know everything. If I am showing you two patients, one patient is having pain, another patient is having anxiety. They are telling I am having tension. Whom you will be cared first? You will be caring pain patient first. Why? Because they are physically. You will tell anxiety patient, I will take care later, but let me take care of pain first. The same way, emotionally down patient, they always think that I will get attention if I will show something physically. Student nurse is very anxious about exam. They may develop headache, but reality base, if you see the head, even you go for any investigation or any checkup, there no any sign of such headache. But why this is? Because of emotion. They not want to appear, for example. So it's a disorder also, conversion disorder in psychiatry. Woman invited for party and she is not willing to attend. She saw reason for headache and body pain and she withdrew herself from the party. And usually when the party time is over, her symptoms resolve because she don't want to attend the party. And so she will tell, I don't want to attend because I am having some body issues, headache or body pain. And she will not go. She will withdraw herself, and after the party she will be all right. Fixation. This also I told you in negative defense mechanism. Even this is even in psychology, I mean in the psychoanalysis of Sigmund Freud, we have learned about fixation, that every individual have some stages, like oral stage they are having breastfeeding. After 1 year they should stop breastfeeding and they should go for next stage, anal stage. But some people will have over satisfied or they are fixed to that particular stage, they will not move ahead. So they will have all the factors, all the stages, features of previous one. Thumb sucking. Adulthood also people do thumb sucking, nail biting, which is a childish behavior. Smoking, drinking alcohol, these all are fixation behavior. Daydreaming means withdrawing self in a private, satisfying world of imagination. Negative one, just sitting and dreaming like I am the president of America, or a youth will be dreaming that I am become a famous actor when he cannot do acting, but still he will dream. Or a beggar who is begging for poor, he's a poor people, he know I cannot do anything because he is not doing anything, and he will just imagine that I am become a millionaire of this world. Daydreaming. Next is withdrawal. Withdrawal is also a defense mechanism of negative. Here the person withdraw himself. He will avoid himself from other situations that causing failure. A child will not participate in any game of fear. He feels that if I participate, I will lose. So better I will withdraw myself. Nurse who feel that she is not able to assist the operation, she will give lame excuse and escape from the risk. She has been called for operation theatre for assisting the doctor, but she is not confident enough and she will just give an excuse that I am not feeling good, and he will like withdrawing herself. Next is identification defense mechanism. Here unconsciously we are adopting, identifying. In the Sigmund Freud psychoanalytical theory also we have seen the phallic stage. The boy, they have castration anxiety and they are identifying with the father. Every characteristics of the opposite father's personality they will take. Same after hospitalization for a minor surgery, girl want to become a nurse because she developed, she see a nurse, she understood nursing is a good profession because she got a good care from the nurse. So she will identify all the characters of that nurse. Even some watching some film of any character also we may try to adopt, maybe hero or heroine, and we feel if they are crying also we will also start crying. So they are just trying to, unconsciously it happens because we are involved in too much and we feel that everything is good for us, and it may not be constructive, sometimes it may go negative effect. So now I will see this total 18 defense mechanism. Many more are there, but these are common defense mechanism. So let us take you into a questions like name the defense mechanism in the following. First question, demanding extreme degree of healthcare for the patient whom you dislike. It is reaction formation. Why? Because you do not you dislike that thing, but you are showing I am liking. I am weak in studies, but I am good in drama, doing drama or role play. Compensation. I am in pain, but I will tell no, I am not having any pain. I am not accepting the pain, means denial. Staying in your room when your friends are at party. All your friends are gone at party, but you said I am not good. I don't want to attend the party. You are withdrawing. See, these are good examples because it may ask in your exam. Pretending that everybody is a liar. We just think that all are lying. Sabne jhoot bola hai. It's like that. Why? Because you also lied. So projection. We are blaming others. Forgetting that you failed in 5th standard. You forget. I do not want to remember that I have failed in my 5th standard. It is repression. I am unmarried, but I will do some social work for orphanage. Orphan means those are orphans, anath. So I will do something for anath people, right? So that is socially accepted sublimation. I want to become like a star, celebrity, so I will do everything like a dressing like a star. Identification. Crying when you make an error. Simple error you make and you are an adult, you are crying. Regression. Regression means immature way you are behaving, right? Arguing with a junior student when angry with principal. You are angry with your principal, but you cannot show back to that principal, and unnecessary you will make some reason to make, and you shout to your junior student. That is displacement. You are displacing the thoughts. Many examples are there. Like cultivating the friendship of the best student. You are trying to make a good friendship with your some other friends in your classroom so that you can identify the features. Identification. Talking about other students also. I am not good. I have failed in anatomy and physiology. Then I will tell what excuse or blaming that other students are also failed in anatomy. Sometimes people tell in their home also. Parents may ask why you are failed. Then you will tell everybody in the class has failed. That is projection. Saying I don't like the prize anyway when failing to win. Because I have not achieved anything, I have failed in my competition, then I will tell, no, who want to win? I was just participating only. Just simple excuse like rationalization. Yeah, I hope you remember about sour grape. That grapes were sour, angur katta. Because I do not want to, I know I cannot do that, so better I will tell. Or sweet lemon. So this is like a sweet lemon characteristics. Becoming ill or feeling sick and cutting the class or examination or test. I am feeling ill, I am having a headache, so I cannot give the examination. What it is? Conversion. Emotionally I am down, so I want to convert into physically that I am having hurt. So that is conversion. So that was about defense mechanism, and last part is about adjustment. What is adjustment? It is a process. Your living organism will maintain a balance between its need and circumstances to influence the satisfaction of this need. It is a continuous process. It is not a fixed process. It will happen in your daily life. Now you are adjusted to your nursing course. Starting maybe in the first few months you may not have adjusted, but you have adjusted now because you started learning about the thing. So two types are there, personal and social adjustment. Personal adjustment means you are harmonized with yourself and the environment. Like you are adjust with your physical health. I am free from stressful disease. I am enjoying my personal judgment. I am free from mental disorder. I am not having any mental health issue. I am personal adjustment with that mental health. One who is not keeping good mental health, that means they are maladjusted. That is the opposite of adjustment. Maladjusted personality like anxiety, distress, stressful, frustration. These all are enemies for this adjustment. Emotional adjustment means emotionally also you play a good role in directing others and you give a good personality makeup, right? So emotionally also you are capable to understand your emotions in a proper way. And sexually also, whether you are able to meet your sexual need, it is an important aspect of our life. So if it is not properly satisfied, then you are not adjusted yourself. This is very important point, and adjust with respect to the individual needs also, because hunger, thirst, physiological need, it is required. We have to adjust with that need. If I need food, I have to adjust with that. Material need, maybe clothes, shelter, leaving home. Socio-psychological need to love, need for expression, getting respect from others. These all are the things we have to adjust with the respect. And what is about social judgment? So one was about personal adjustment and next is social adjustment. Like man is a social animal. We have to be communicate. Now we are in a nursing profession. So you should think that you should communicate properly with the person. Home, family, we are socially adjusted. Every member in the family work for the progress of the house. Friends or relatives, you are adjusting, you are creating a group with the friends or relatives who are coming in our help in the hour of our need. Or whenever we need, they are coming and we are adjusting with that. With our neighbors or any members of your community, maybe in your nursing community also, maybe another college students or maybe some nursing leaders or anybody in nursing association, you are associating. Why we are doing? To create adjustment with that profession so that you will be able to understand, you will be able to having a proper cooperation and team spirit. There are various problems also occurs. If you are not adjusted with it, maladjustment will happen. So maladjustment is one of the biggest issue. One is that mistrust. You will not be able to trust anybody. If you feel that that person is not good, he did some cheating on me, so that is a mistrust. Lack of communication, absence of communication. Some people feel I cannot talk in front of people. Lack of respect for right of others. You should respect others also. Already I told you, you have to give the respect and take the respect. Insecurity sometimes happens because we create anxiety, inflexibility. We are having more rigid environment, or we can have very strict environment. So I cannot follow those things. So we will feel I am inflexibility. Need for power. We need always power. Some people always want everything powerful in their hand only, but some people feel very powerless. I do not have any power, so I cannot influence you. Over dependence. Being over dependent on others is also very important problem, because we depend on others and we are not able to adjust. Now you are living in hostel. Maybe you are living in hostel, you left your home, so you have started adjustment. But some people tell, no, I cannot live in hostel, I want to be in home, I am dependent on my home or my parents. Depression, hostile behavior, like very much anger or conflicts, disagreement with people, because you are not adjusting with that. I cannot adjust because everything should according to my expectation, and if that expectation is not fulfilling, then I cannot. Then over responsibility, low self-esteem, irresponsibility, fear of intimacy, fear of rejection. These all are various types of fears happens. We feel I am not good, I have been rejected by the society, I do not have autonomy, means I do not have independence to do anything. These all are maladjustments. So I cannot adjust with anybody. I cannot even live with anybody. So these are various important questions in this chapter. Guidance and counseling already we have learned in another chapter. So this is also important, but mental health, mental hygiene, what are the common issues occurs if you are not adjusted well? Which are the warning sign of poor mental health? Characteristics of the mentally healthy person, defense mechanism, and explaining each defense mechanism in detail, because it's very important question even for competitive exams also. So I wish you all the best to have a proper good mental health, so that if we maintain our mental health, we can adjust with our life, we can adjust with society, with others, as well as we can take care of mental health of our patient as well. Thank you.